I was straightening up the house one Sunday, and all of a sudden I saw double. And 15 minutes later it was gone. But then the following Sunday it happened again. Then I got a little concerned. I went to a local eye institute. I had a spinal tap and I had every kind of MRI. He couldn't find anything wrong because every test he took came out negative, and then sent me to a vascular neurologist. He found out that I have severe carotid artery stenosis on my right side. Said, "You're a walking time bomb. You can have a stroke at any time."
As expected, I was seeing a very hesitant future patient because the word surgery is, I believe, scary to anybody. And she was almost on the verge of not doing anything and just letting it go.
Searched around for different neurologists, and they all recommended Dr. Ricotta. And he knows how to treat carotid artery diseases through minimally invasive surgery.
So in Sharyn's case, she had a 99% blockage in her carotid artery. And there was just a little tiny pinhole opening where the blood was getting through to her brain. Patients 75 years or older are usually at an increased risk for the traditional surgical procedures like carotid endarterectomy. Would be better off with the minimally invasive approach of TCAR.
It's less invasive, faster recovery, less scarring, much safer. He explained everything, because I'm the type of person that needs to know what to expect. He even explained everything so that we could understand, I guess you would say, layman terms.
We felt that this was definitely the path to go and to put it in the past.
When you're doing carotid surgery, it's all about how you're protecting the brain during the surgery. Anytime you put in a wire or balloon or anything into the carotid artery, you're at risk of breaking a piece of plaque off and it going into the brain and causing a stroke. TCAR uses this really novel mechanism where it reverses the flow in the brain. The blood is flowing backwards. So anything that might break off during the procedure, it's not going to go into the brain, it's going to get sucked backwards. It sort of combines the best of the surgical treatment, carotid endarterectomy, and the minimally invasiveness of stenting.
Boy, am I thrilled that I did find out about Dr. Ricotta, have the TCAR procedure. I feel wonderful.
And each day she felt better. It was rather rapid, which is exactly what Dr. Ricotta said would happen with this procedure.
His team was wonderful. Everybody in his office was wonderful. Everybody in the hospital who was associated with him was outstanding.
Sharyn was our 200th TCAR here at Delray Medical Center. We're a national center of excellence for TCAR, and we have been every year since 2018, which is a designation that's given only to a few centers nationwide. I think what sets us apart from other places is that we take this holistic, comprehensive approach to the patient, and we could not achieve the great success that we've achieved over the last several years without this team approach and everybody buying into our philosophy of patient first.
I have more energy now since I had the procedure with Dr. Ricotta than I've had in years. And I also feel smarter, more alert, because the blood is flowing to my brain now, where before it wasn't. I never felt so good. I said, I wish I could at least hold your hand. Well, Jerry made a picture of his hand and gave it to me. Whenever you need an old familiar hand to help you through your day, reach out and I will always be there for you.